some familiar faces, and then to see some faces that I'm sure we'll have an opportunity to get to know afterwards. Here's my suggestion. There is not this massive crowd getting ready to run in. So if you would like to come up a little bit closer, feel free to. You don't need to feel compelled to, but if you want to come up a little bit closer, feel free to do that. But the good thing about a class being this size as opposed to having this entire room filled up is that you have a much greater possibility of having your question answered during the Q&A, and an opportunity to get to know the people that are sharing and speaking today. So we look forward to that. I think that I was commenting to Michael Shapiro just a moment ago that it's interesting in a situation like this, you don't have a lot of people coming in wondering, I wonder what this class is about. You know, you've got people coming in here who we've all experienced some things, are experiencing some things, or trying to figure out directions, ways to go, and we could use just a little bit of extra help. So my name is Jake Jansen, my wife is Nancy, and she wrote a book entitled Resurrected Mind about our son Jesse Jansen, who has severe Tourette syndrome, OCD, and a host of other things to go along with it. You know, when you've got a child with special needs, characteristically, you get more than just one diagnosis to roll with. But I'm Jake Jansen. My wife's not here. Unfortunately, she got grounded about 10 days ago by her doctor because her white blood cell count was too low and she could not be exposed to as many people, especially on an airplane. But she would love to be here. She is accessible via email and that sort of thing. So along with me today, we're going to begin with Michael and Mary Shapiro. And I'm looking forward to hearing what they have to say. Hopefully this track is going to be beneficial for you. They'll be beginning the track, and then they'll be making a presentation, have some Q&A. Then I will be in the middle, and then after that, Brock and Ann Roby and Suzanne Stroebel will be sharing with us. So let me go ahead and have Suzanne make an announcement. We'll have a prayer and we'll get started.
Just real quickly.
Thank you for inviting us to do this. We're honored to be here. By way of introduction, we're Doctors Michael and Mary Shapiro. We've been child psychologists for 32 years, which I know we don't look that old, but trust me, we're that old. So even though we do not have, we've got 3 children, we've got 2 grandchildren, even though we don't have children with special needs, we've worked with them and their families for 32 years. We also teach a lot of workshops kingdom-wide on marriage and parenting and mental health issues. So the first thing we should probably tell you is, as parents of special needs kids, you can take everything you've learned in a parenting workshop and either throw it out completely or multiply it by 100. I don't know. You're going to have to, you know, it's never a one-size-fits-all, and every time we do a parenting workshop, we're assailed by parents of special needs kids after the workshop, and they say, "Do you realize that everything you say doesn't apply?" And I'm like, "Yeah, definitely." That's why we're glad to meet with a group like you. We want to help you, though, with your marriage. You know, parenting a typical kid is hard enough, and we realize that having a child or children with special needs multiplies the stresses and the emotional strain infinitely. And it's much harder to be a parent. On the other hand, tell me if I'm wrong, but are not the victories, when you do something well, they're that much sweeter, right? So we deeply, deeply respect you as parents of special needs kids. I want to start out by saying having a special needs child has implications for 3 relationships. Your relationship with your child, your relationship with God, and your relationship with each other. So I want to talk about the God relationship first. I'm not telling you anything you don't already know. I'm sure as disciples who are parents of special needs kids, you've had many crises of faith, haven't you? I mean, we can't even imagine. There's guilt crises, there's crises of why us, why my child, why did this happen? So I'm sure you deal with that all the time. You're wondering what purpose, what plan God might have in all of this. As I said here, I'm not telling you anything you don't already know, but as with any stress that's common to man, it's our prayer that whatever it is drives you closer to God and makes you more faithful instead of driving you away from God. And that not only applies to, you know, dealing with sin and anything else you have to deal with day to day, but especially in dealing with a special needs child. We pray that this experience pushes you closer to God, never pushes you farther away from God. How to make sure that happens, that's not something that can be covered in a 40-minute talk. That's the process of becoming a mature disciple. But there are lots of biblical examples we can draw on. Real quick, I want to look at John 9, 1 through 3. So it says, as he went along, he saw a man blind from birth. His disciples asked him, Rabbi, who sinned, this man or his parents, that he was born blind? Neither this man nor his parents sinned, said Jesus, but this all happened so that the work of God might be displayed in his life. I'm sure you all have read that before and consider that it applies to you. You might never know, the moral of this story is you might never know the answers, the why answers. But one way you can glorify God, as it says in that scripture, is by having a great marriage while raising your child with special needs. As for your relationship with your child, my guess is you've already become experts in your child's condition, your child's diagnoses, and in all the research about it, and you've become experts at adapting all the information you get towards adapting it to the particulars of your child. If not, that's the first thing we urge you to do, is become experts. Knowledge is power when it comes to raising a child with special needs. And, we've got a lot of families in our office that are in denial. Or at least one of the parents is in denial. And not picking on the brothers, but most commonly it's the husband. I'm just saying. And it bothers me, the more knowledge you have about your child's condition, all the research, all the treatments, the better position you're in. And it's a great thing to do that together as a couple. Learn everything you can. That way you can make wise decisions together. And that means, incidentally, going to appointments together. A pet peeve of mine is that when we do evaluations on children, or we see, there's some kids I've seen in therapy for years and have never met the dad. There are kids who I've done evaluations on, and we come to the point of making a diagnosis, potentially the most important pivotal event, of this child's future, and the dads don't show up. They leave that to the mom. That's something that always has bothered me. So I urge you, do these things as a couple as much as you can, within the practical realm. But at least, in situations like that, I tell the moms, your husband is welcome to call me anytime. I'll set up a separate appointment. So please do these things together. Now, with regard to your relationship with your spouse, of course, remember that if you have a special needs child, Satan has yet another thing to exploit in his attempt to ruin your marriage. So we want to help you make sure that the conflicts you're inevitably going to have over your child's issues don't drive you two apart as a couple. Remember, when you got married, you took a vow. Remember that? Yep. Your vow was not just to your spouse. Your vow was to God. And your vow was to take care of each other in sickness and in health, to love and cherish and honor each other. And when we say sickness and health, we don't just mean yours, we mean that of your child. So remember, you took a vow to be in this together. And remember, Numbers 30 has a scripture about taking a vow and how God doesn't like it when you break your vows. So please remember the commitment that you made when you got married, that you're going to do this together. Remember Ephesians 5, applies in all circumstances. Submit to one another out of reverence for Christ. So when you have a decision to make, and you're weighing all the issues, you're examining these issues together, you're going to come to loggerheads about things. Treatments, potential treatments, medications, who to go to see as a professional, how to parent this child. Once again, I'm probably not telling you anything you don't already know, because you're inevitably going to come to loggerheads about things. Remember to submit to each other. So at some point, you got to move on and come to a conclusion. You have to make a deliberate decision to not let disputes over the care of your child interfere with your marriage. Excuse me. Marriage is the foundation of the family. If you want to help your child, the best thing you can do, the first thing you can do that's best for that child is to have a great, secure, and unified marriage. You know, the decisions that you make about your child are very emotional. I know. They're charged with emotion, and it's very hard to be objective. So that's why you need advice from other couples. You need to build a family. You need to build a circle of other disciples that can help you, even when those disciples don't have kids with special needs. I'm sure many times you've said, they don't understand what we're going through. That may be true, so educate them, train them. You've got to have other couples in your lives to help you when you come at loggerheads and you're making big decisions. And always remember, certain decisions, like decisions about school programs, which professionals to consult, a lot of decisions aren't permanent. You can always change them or go back on them. Here.
You know, we know how hard you guys work to make sure that your children with special needs do well. It takes a lot of time, a lot of energy and thought and prayer. And we just want to urge you to do that same, have that same determination for your marriages to do well. You know, marriage is kind of a living entity in itself. It's either growing and getting better or it's dying. It's only two states. And so if you neglect it, it's not going to go well. So, you know, we just want to encourage you to spend that much time and energy on your marriage as you do with your child. I want to talk about just some practical things that might be helpful to you. We have a wonderful couple in the Athens church that had a child with a significant heart defect. And the child actually passed away at age 3. And I talked to that brother before I left. I said, you know, we're doing this class. I really want to know, how did your marriage make it through? And these people are wonderful. They love each other. They have 2 other kids, serve in the church all the time. And he said, you know, when she was diagnosed, when we knew what we were facing, we made a verbal commitment to each other that we were not going to let this ruin our marriage. And we kept saying that through all 3 years of her illness, you know. So make a verbal commitment to each other. Again, you know, like you did on the day of your wedding, that this challenge that we're facing is we're not going to let it tear down and ruin our marriage. You know, you have to find some time to devote exclusively to each other and to your relationship. And this is hard to do, I know. I mean, it's hard to do when you have a house full of kids that don't have special needs. It's hard to do. You know, it's even more difficult to do when you have a child with special needs. But your marriage so much needs you to do this. I just want to encourage you to get creative. You know, see what kind of respite care you can get for your child so that you and your spouse can get away and have some time together. You know, find a babysitter that knows what they're doing, that knows how to take care of your child for a couple of hours so you can go out and see a movie or get dinner. You know, maybe a family member that you trust with your child. You know, another family that has a special needs child. Maybe you can kind of come to an agreement where we go out one weekend and you go out the next. But you're so much going to need that time away with your spouse just to work on your marriage relationship. And by the way, when you go to dinner, when you do find somebody that can take care of your child and you go to dinner, don't talk about your child all the time at the dinner. Talk about something else, you know, talk about your hopes and dreams or whatever, you know. But you've got to have that time one-on-one with your spouse to nurture that relationship. One thing that I think would help is as soon as you possibly can, get your child to have a regular bedtime, all of your kids, if you have multiple kids, get them on a regular bedtime schedule where everybody goes to sleep at 8 o'clock or 9 o'clock at night. You know, if you have a special needs child, depending on what challenges they're facing, this can be difficult, right? I mean, you know, bedtime and sleep can be difficult, but work at it. You know, get help from your pediatrician if you need to. In the long run, it's going to be worth it both for your marriage so that you and your spouse have a little time by yourselves every day just to be husband and wife, and it's going to benefit your child as well. You know, we see kids, you know, like you said, we see 6 to 8 kids every day in our office. And I'm convinced that a lot of the behavioral problems that we're seeing these days is because of sleep deprivation in our kids. We're not getting our kids, they're hard to get down, they fight bedtime, and so a lot of parents say, I give up, I just let them stay up as long as they want to, and then they sleep on the couch in front of the TV. Well, no wonder that kid's getting in trouble in second grade the next day. So it benefits the child as well. This is just a suggestion for your whole family. Try to have dinner times together. Having dinner time together is such a powerful thing. There's actually research that says that having dinner time together decreases behavioral problems in school, increases academic performance, decreases drug addiction and juvenile delinquency. Having dinner together. But it's getting to be more and more of a rare thing, having dinner together as a family. Again, if your child has special needs, depending on what they're challenged with, this is going to take some work as a family to make sure you have dinner. It's not all going to look like an Aussie and Harriet dinner, right? Some of it's going to look like, what's it called, Desperate Housewives sometimes, all right? But try, make it a part of your family routine that you have dinner time together. For your special needs child, this is a time that they can learn self-control, that they can learn how to interact with family members better, that they can learn some social skills. For your children that don't have special needs, it can be a real security for them, that your family eats together every night. And just a tip, turn the TV off and don't allow iPhones or this or that at your dinner table, and that includes mom and dad, by the way. Your dinner time needs to be a time out from the world for your family to interact with each other.
I'm not sure if Desperate Housewives was the right reference, but okay, you get the idea, right? Okay. Mary, in addition to everything she just said, we want to tell you, when you implement these things, time alone, time together, time away from your kids, don't feel guilty about it, okay? You're going to be tempted to feel guilty. In today's world, like we said, the best advantage you can give that child is a strong marriage. So the time you take away from that child and you're working on your marriage is a benefit for him. And it'll keep you from going insane, hopefully. If not, we'll pass out cards. Business cards. Yeah. Let me say another word about developing friendships that can help. The phrase, it takes a village? As you probably learned, when it comes to a special needs child, it takes multiple villages, not just one. And you establish circles. You've got your circle of medical professionals that help, right? That you know and trust, the pediatrician, the neurologist, the psychiatrist. You have your circle of educational people that help, the IEP committee, the vice principal, the response to intervention, all that stuff. And then you have your circle of disciples that give you moral, spiritual, and emotional support. One thing, though, is we realize that when you try to share your difficulties with people who don't have special needs children, they don't know what to say. So they may inadvertently say some really insensitive things. I see a lot of nodding heads. As an example, I'm a motorcycle rider. I was in a really bad accident last August, almost a year ago. So Mary, my poor wife, was really freaked out. And when she went to church the first Sunday after my accident, you know what most people did in an effort to sympathize and show compassion, so they took her under their wing and said, I had a cousin that this happened to, and he broke 87 bones and, was near death, and, man, it didn't really help her. When I finally was good enough to come back to church, everyone was like, I love you, but you really need to give this up. And so people care. All disciples care. They're just going to say insensitive things because they don't know what else to say. So I'm asking you to educate your brothers and sisters. Be assertive in what you need them what you need them to hear, what you need them to tell you, because they really don't understand. Don't be shy to ask for something specific that you might need from them.
I want to talk for just a minute. If you have a child that has special needs and you have other children, I want to talk about the other children for just a minute. It's a struggle to judiciously distribute your time and energy, right, as a parent, when you have a child with special needs and children that don't have special needs. And it's usually not you can't do 15 minutes with one and 15 minutes with the other. Life doesn't go that way. That's not the way it is. But I just want to talk a minute about some of the needs that siblings of children with special needs have, because they have their own set of needs. I've counseled a number of siblings of children with special needs, and they have some very unique challenges themselves. A lot of them feel guilty that they don't have something wrong with them. They feel guilty that they're healthy and developing normally. Some of them feel embarrassed by their siblings' behaviors. And then they feel guilty about being embarrassed because they love their brother or sister. Some of them feel jealous of the extra attention that their brother or sister get. And then they feel guilty about feeling jealous, So it's kind of this vicious cycle of emotions that these kids have to deal with that we need to be aware of, and you as a parent need to try to give them some help with. One of the things I think is helpful for them is they need respite from their brother or sister just like you need respite from that child sometimes. So, let them go to a trusted friend or family member's home to spend the night or for a couple of hours, depending on their age. Let them go to church camp. Let them go to places that they're going to be safe, but that they can have kind of time away, that they don't have to worry about what the challenges that are being faced by their brother or sister. Let them participate in a sports club or some kind of interest group if you can afford that. Just some time that they get to be away and just be normal kids. That's what they need. Try to arrange some one-to-one time with that child or children. Where you can really do something where it's just you and them and they get that extra attention that they may not get on a daily basis because of the needs of their sibling. During that time, you need to talk with them in an age-appropriate way about what their brother or sister is facing. Kids are little emotional radars. They know what's going on in the home. They may not have the vocabulary to put words to all of it, but they know if their brother's having a hard time with something. And you may not want to go through, all the diagnostic labels that their brother or sister got. That may not be appropriate, but just talk to them in an age-appropriate manner about this is what your brother or sister is living with, and this is what's hard for them, and this is why we have to spend more time with him sometimes than we do with you. Also, encourage them, let them know that it's okay for them to express their own feelings about what's going on. Let them know you're not going to hurt my feelings, honey, if you come and you tell me you feel left out sometimes. That's not going to hurt my feelings. Now, we may have to come up with a creative solution to that, but I want to know how you're feeling. Encourage them to talk with someone that you trust outside of the family. They may need a mentor outside of the family, somebody they're close to at church, or a counselor even. Like I said, I've worked with a number of siblings of special needs children in my practice because they just needed somebody that they could talk to about everything that was going on.
We've been told what that means. These are brief talks. So let me make one more point, and then we're going to open up for some questions if you'd like. Let's end with a scripture in Matthew 6, verse 33 and 34, which you probably have memorized by now. But seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. Each day has enough trouble of its own. One thing I want you to remember is you're not a prophet. You don't have a crystal ball. We do a lot of evaluations on really, really young kids. So consequently, Mary or I are usually the first professional that gives a diagnosis to the child that starts on this path of treatment for the rest of the child's life. And sometimes it's not good news, So we sit down and I explain things. I explain all the tests I've given. I tell them what I think this diagnosis is, and I can see it in the parents' eyes. They immediately go to, what's it going to be like in 18 years? What's it going to be like in 21 years? What's it going to be like when he becomes a teenager? That's their immediate first thought. And they ask me things I usually can't completely answer, like, is he going to be able to do this or that? You don't have a crystal ball. You're going to drive yourself crazy worrying too far ahead about the future. Every day has enough trouble of its own. You know, I just want you to pray and work together and ask God for the grace and the strength to deal with that daily trouble and not think too far ahead, which, you know, like I said, may drive you crazy. I tell parents all the time, you know, if I give a diagnosis that doesn't have a great prognosis, and they ask me these questions, what's he going to be like in the future? I try to give them an answer, and then I say, no one is going to be happier on this planet than me if you come back here in 18 years and you say, remember when he said he couldn't do this? He's doing it. Remember said when he wouldn't be able to do that? He's doing it. No one will be happier than I am. So please don't drive yourself crazy thinking too far in advance. Every day has enough trouble of its own. And like I said, pray for the victories. They'll be all the sweeter. And value the successes. That having been said, let's do a few minutes of questions. Yeah, yes, ma'am.
I think they, I want to talk about single moms with children. Because I'm a single mom, my children are 22 and 23. His father is in his life, but we're not married. So many things they say that we're not going to be able to do it. Thanks to God, one of them just finished his 4 years of college. The other one is in college, but it's a struggle every day in different ways.
Yes.
Like even talking, you think they got it and they didn't get it. And then they get upset at you because you didn't tell them that. Or things like that. What you have for all the single moms.
The question is about single moms. We were asked to talk about helping marriages. However, we should have a whole single parent conference because you can take all the struggles we just talked about and multiply them by 2 at least, or maybe it's exponential, multiplying by 4. So I think a short answer is, remember the villages we're talking about and the circles, even more important for a single parent having to deal with a special needs child.
Yeah, I mean, the other thing I would encourage, you have boys, do you have boys, you said?
Yes.
2 boys. You know, as a single mom, I mean, one of the biggest handicaps is we're not boys, you know, raising boys. So, you know, if you can find your sons a mentor of some kind. I mean, we did this even for our sons, even though we were married. When our son was going through middle school, he was at that age of everything we said just kind of went by, you know, every day, didn't matter what you said. And so we rented this college brother from church that he kind of liked, he kind of looked up to. And I said, I'll feed you, I'll do your laundry, I'll give gas money, just come and hang out with him for a little while. So he did. I mean, he came over once a week, and I did his laundry, and I fed him, and he took Robbie off, and they went to the park or did whatever they were going to do. And Robbie would come home and say, you know what Tim told me today? Tim said I need to do, and it was exactly what we had been saying to him for the last 6 weeks. Exactly, but because Tim said it, you know. So if you can find an influence like that, that may really help you out.
I was raised, incidentally, by a single mom. My dad died when I was young. My mom, God bless her, always made sure I was in the presence of positive male influences. You know, the first summer, my dad died in the winter. That first summer, we went to a camp. Not like our church camps, which are a week long. This one was 2 months long. But so that I wouldn't feel abandoned by another parent, she went as the camp nurse. But she always made sure I had strong male counselors, strong men in my life to influence me. I'll never forget that. There's another hand. Yes, sir.
I have a daughter that's 16, and she has multiple diagnoses, and I am a single dad, and my question is surrounding residential placement. So the school district has given us paperwork. That's what they're recommending. I can't take her to church anymore because she's violent. And so, anyway, split time, you know, 50-50 with her mom, who used to be a disciple, but is no longer a disciple. Do you have any thoughts on, only one of the placements is in California where I live.
Yes.
3 of them are outside the state, and she is 16, but it's more like she's 8 or 5, like she still touches her thumb, you know.
I have very strong feelings about it. The question was about residential treatment. I tell parents in my office that we start talking about residential treatment if 2 conditions are met. 1, if someone doesn't feel safe in their own home. If a sibling or a parent feels threatened or unsafe in their own home, that's one time we start talking about residential treatment. The other is if there's anything illicit or illegal going on under your roof. You know, if kids are, I don't know, I've had patients that were stealing credit cards and, you know, smuggling drugs through their home and things like that. Under those two conditions, and those aren't exhaustive, I don't know about your particular situation, but there are other conditions as well. In such instances, residential treatment is a great option for a couple of reasons. One is residential treatment is the only place where your child can't get out of a consequence. They can do what you can't, which is have eyes on that child 24/7. You know, if it's a therapeutic camp kind of environment, for example, you know, they have house parents, some that take shifts. Someone will be on that child 24/7, and that child will have a consequence to every behavior. Oh, is your daughter developmentally disabled as well?
Yes.
Yeah, it's the same, it's kind of the same thing, you know, it's the things that exhaust you, especially as a single parent, they can do. And most of the best residential treatment facilities we know of involve the parent. It's not a dumping ground, you know. Some of the ones we refer to, they require family involvement. The parents have to go every week for family counseling or, you know, educational things and so forth. So if those conditions, or if you just can't keep up with the demands of a developmentally disabled child, but vet that facility really thoroughly. You make sure you go, you see what it's like, you get opinions from other parents who've had their kids there.
Yeah, you know, it's just, I mean, it's a question of level of care. You know, if your child, if you're having difficulty taking care of your child at home, then you have to go to the next level of care. You know, even with outside therapies and things like that. You know, it's kind of, and I don't know how many of you are taking care of aging parents right now, but it's kind of the way we think with aging parents. You know, when is it time for them to go to assisted living? Well, when they are leaving the stove on in their condo, it's probably time for them to go to the next level of care where they can be taken care of. And of course, that's always such a hard thing. That's always such a hard thing to do. But if you're beyond the level of care where you are right now, then you have to go to the next step.
Let me add a warning. If you're considering residential care for a child because of behavior problems, just be prepared that they will unsheath the full power of their guilt-using abilities, you know, guilt-making abilities, and make you feel bad about this decision. This is proof you don't love me. I told you hated me, and now you're kicking me out. They'll have that whole arsenal ready to go. What you have to remember is this is the best thing for that child and for you as a family. And, you know, usually the counselors there and the staff there help you with that whole transition, but that's just a warning. Any other? Yes, sir.
We lost our daughter 5 years ago. What are the practical advice for making the cost of losing Father is the oldest province in the northern
country. Grieving, oh my. Well, this may be above our pay grade. The question is about grieving the loss of a child and the potential loss of another with a life-shortening illness. You know, there seems to be a movement church-wise in local churches that we're getting much more sensitive to grief issues. The evangelist in our church, Sonny Sessions, some of you know him, Sonny Carolyn, lost a grandchild recently. So we're getting, as a church, I think we're getting a better handle on this process. So I would look for support. You know, there are other people who've been through this. And then, you know, the short answer is for your family and for your son that's still here, get professional help. That's a big ongoing counseling issue.
You know, the other thing I would encourage you is give yourselves time to grieve whenever you can. I mean, it is you have to make it happen. You know, you have to step out of life, whatever that means for you. and allow yourself to have that time, you know. So you need that. The other thing I would encourage you to do is enjoy every second you have with your son.
So, yeah, right.
I have a question about siblings. How do you make sure the siblings are contributing to the special needs child? And it manifests more in like anger and things like that. And so they get critical of him. And they're like, oh, so that we're at the conference, he's not here with us. They're all teaching.
Yeah. Well, you know, the question is, how do you keep a sibling from getting critical of the involved sibling if you have a non-involved sibling? That's, you know, if you had a family full of typical children, you'd be facing the same thing. You know, they don't all live happily ever after together. So, you know, it's a, I know you're trying to raise your children under a Christian roof, you know, so it becomes a discipling issue at that point. You know, and you can train, I'm sure you've trained your non-involved sibling about your involved sibling's condition. You've done the education, you know. From that point on, it's a matter of character and heart on the part of the non-involved sibling. So you talk to that sibling about, you know, this is a person worthy of your respect, not your disdain. This, you know, you have, this is where empathy comes in and make it a character thing.
I mean, I agree with everything you just said. I think you have to see those feelings as normal, though, in a way, and kind of validate those big, you know, that, yeah, it is a relief sometimes. You know, I know it's a relief for you sometimes when he or she is not with us. You know, I understand that, but, and then say everything he just said.
Green shirt, sir.
Yes, I have 3 children with disabilities. The first one had multiple. The second and third autism. The first one, when he was born 9 weeks early, we weren't worried about 16, 18. We were worried about today because the doctors thought he may not live 3 days. He gave us 10.5 years. I'll tell you, there are lots of supports in the community, and we found lots of people don't know about them, that they even exist. So learning how to advocate and finding advocates in that community help a lot. For different things, whether it's residential care, getting the waivers, getting the support, things like that. So that's just a comment.
Thank you.
But also, the one thing that is a challenge that I'm trying to work through, my second child, who just turned 18, has been involved, you know, he loves being around people, loves being around the teen ministry. The thing is that his direct interactions are always very brief. And the difficulty is trying to find that teen or young 20-year-old who will actually be willing to take the time and be patient and hang out, even if they're not interacting, be there and try to, little at a time, work with them. That meant that here, we could do something that dad can't do or mom can't do because he doesn't have any close friends. But he loves being around all of them.
Right.
And I don't know if you have any.
Well, please, the only thing I'd add, you know, if you're, usually there's somebody, you know, in the Athens church we have a big campus ministry. So there are kids studying to get their degrees in special education that are willing to take on a project like that. And they see it as more of a project. They really want to get to know your child and help your family. If there's no such resource in your local church, don't be afraid to step outside and look elsewhere. I have a patient, a little girl patient, who's been through a lot of trauma, and the mother, she's being raised by a grandmother, and she asked me, do you have is there a mentor or someone at your church that might be able to deal with this girl? And I couldn't think anyone, but I did know that the University of Georgia has, this little girl was into basketball. I have connections with the University of Georgia Athletic Association. So I called over, and I said, is there a young lady basketball player that might want to mentor this child? And it worked out great. So I'm saying, don't be afraid. God will guide you to resources, even if it's outside of our church.
But the only, I think we have to understand that, you know, I mean, some grown people don't get it, but especially young people don't get it. You know, teenagers don't understand having an illness or having a disorder or somebody dying, or, you know, they don't get it. They don't, unless it's been in their experience, you know, they're not being uncompassionate, they're just being immature, you know, yeah. And so, you know, like he said, I think that, you know, maybe finding somebody that's a little bit older or somebody that has had some experience with something like this might help a little bit, yeah.
And going back to the initial part of your statement, which was what? I just had a thought and it flew right in and out.
You said there are resources, community resources.
But right before that,
Advocate.
I'll think of it in a minute, and then I'll interrupt everything. Let's take one more. I think we have time for one more. No? Yes, sir. Right there.
I'm actually kind of curious to know whether or not you actually see this in your practice and what you're doing. One of the things that I think is a grave concern is that I'm noticing that there are more and more children that are being diagnosed with developmental waste, more now than then. And one of the reasons for why I see that in the profession that I work in is that, and I think that this is sort of what is happening. I don't know if this is happening in your area, but it seems like a lot of the primary care physicians are not necessarily noticing these things in children when they're much, much younger. And what is happening is that these children are growing older, and now they're going into the educational systems, and now these kids are being, you know, the school districts do not diagnose children. What they do is they give eligibility criteria to children, and so this is the communication. I think it's just really broken because there is no real communication. They're not explaining to families exactly, this is the situation with your child, and this is how we're going to work with your child. So families are getting this when the child is now 5, 6, 7 years old.
Right.
And I'm going to even say that probably 2 decades ago, it probably wasn't happening at all. So probably even much later. So this is definitely made a breakdown when you're talking about social interaction, because you talked about that in the very how important that is to have that socialization within the family, which is necessarily not there, and parents need to have their children involved. That's
right.
Major help and helping children to grow developmentally. I'm just wondering, do you concur with what I'm seeing?
Absolutely, yes.
It really is disturbing to me when parents are, and then parents can be very proactive with going into their local hospital to have their child evaluated,
right.
And they're giving a diagnosis like autism, for example,
right.
But not really being given the information on how that child will be educated with autism,
right?
Because they feel you got to do something, and sometimes there's even a break. I think there's a breakdown where they're evaluated, but then they don't necessarily give any advice on how to approach the next steps.
You know what breaks my heart is we see many kids for an initial evaluation, and they lay out a history of developmental problems with their child. And I say, didn't you consult your pediatrician about it? And this is not to disparage any pediatricians, but how many times have I heard, yeah, they said just wait and see. Yeah. Which is, if you went to the iFamily talk, you heard me speak for about 10 minutes on the developing brain and how important, critically important early intervention is. So I urge parents, you be a forceful advocate. We get people calling our office all the time and saying, I think my child needs to be evaluated, but is he too young? And I say it's never too young. We have instruments to evaluate infants in our office, because the earlier you get a positive diagnosis, the better. Now I also hear lots of times parents, when they come in with older children, and I go over their educational history, and I say, does your child receive special education support? Does he have an IEP? And they say, I don't know, what is that? And then we find out, and I said, every year you go and you sign this big sheet of paper, and there's a big table of lots of people telling you about your child. And so we figured that out, and I say, well, what category is he served under? You know, I don't know. So.
And I really want to implore this to everyone in this room, because you made such.
Can you pass the mic so we can hear his question?
Yeah, we can't hear you.
Can't hear
Oh, I'm sorry. I just want to say, I just want to make really accentuate what you said.
Say it out there and say it loud.
He made such a valid point when he said that really, parents, if you can go to these meetings that take place with your local educational agencies where they're talking about the individual education plan, this is so crucial so that everyone is on page with what they're doing. Because I see this as well. They do not know the actual diagnosis of the child. They don't know how the school system is going to actually work with that child or the type of educational setting that is best for that particular child, and whether or not the child can even benefit from additional early learning services or additional socialization and interacting with other children. I've gone to many meetings where I've seen that.
And clamor for, if you think your child has any special need as a youngster, you clamor to get the help. There's plenty of agencies, state agencies that start giving help in infancy up to age 3 when the school system becomes liable. So just be a strong advocate for your child and do so early.
I just wanted to say, with the different professionals, everybody does something different. The pediatrician does this, and the special ed teacher does this, and the speech therapist does this, and the psychologist that gives the diagnosis does this. And everybody speaks a different language, and about half the time they're not even talking to each other anyway, which is why we encouraged you guys earlier to become experts on what's going on with your child. You are the expert on your child, on your particular child, and you've got to be the one to make sure all those people are on board and doing what your child needs.
Thank you for your time.
You may, in the process of the time that we spent together today, hear a few things more than once. And that's probably a good thing, because Peter said it's good to remind you of these things. And, I'm hearing things that are reminding me of what I want to do differently. So let me go ahead. My name is Jake Jansen. My wife, as I said earlier, for those of you who came in just a little bit later, Nancy Jansen, is not able to be with us today. Her doctor clipped her wings because her white blood cell count is too low, and so she's just too suspect to getting some infections right now. So she's at home pulling weeds, hanging out with nobody but the dog in the backyard. So let me go ahead and insert the PowerPoint I have into this computer, and we'll keep going forward. My timer started here to make sure I stay within time too. Okay. My title is Parenting a Special Needs Child. And when I was thinking about the class, I wanted to start just by asking a question. How many of you have children that have a special need of one type or another? Just raise your hands. Okay. All right, everybody. All right, that's good to know. How many of you have spent a good amount of time? How many of you have been to therapists and been to doctors already to address the situation? Okay, almost all of us. How many of you are new to this and you're like, I'm not sure what to do? Raise your hand. There's a couple of us. Okay, raise those hands again. Okay, folks, the rest of us, do you see our friends that need a little bit of help back there? Just raise those hands high, all right? These are some folks that, you can just kind of give them a big hug afterwards and say, here's my phone number. What are the needs of an exceptional family? Number one, a healthy marriage, and I'm really, really grateful there's for what you guys just shared with us about taking time. There's no substitute. It's crucial to be parenting a special needs child. You've got to get help there. And I'll say this right on the front end. I've been around for a long time. Back when we were the Crossroads movement, before the Boston movement, before we were the ICOC. And a lot of things have changed over the course of that time. I remember when counseling and therapy, well, you don't do that. I can go real loud because I also preach, but let me have to do that.
Unless it's the battery.
While he is fixing that, I'm going to go real well. Can you hear me in the back?
Yeah.
All right, I'll do my best until I get it back. I recall, Michael shared about how, the dads are oftentimes the ones that are reluctant. Right here. I recall being in that situation. I don't think we really need this. I don't really think we need to go. And I am grateful for the counselors and therapists that were patient with me, because it took some time for me to come around. But I think that, let me start right off in the front to share something. Marriage counseling, family counseling, if you've got a special needs child, consider it. My wife and I have had family counseling. We have had specifically marriage counseling. I'm in the ministry. I have worked full-time for the church since January of 1986, but we have been very, very helped by finding a good marriage counselor to work with us. And like I said, counseling was helpful once I got my attitude right about the whole process. I think you're going to hear in a moment from the Robys and from Susan about a healthy community, realizing that you're not alone. And the Shapiros shared about that as they made the reference to what I believe Hillary Clinton had said. Hillary Clinton had said that it takes a village to raise a child. Thank God that the church is part of that village for us. Amen? Are you still hearing me in the back?
Yeah.
In favor, raise your hand if you can't hear me, because then I'll get loud again, all right? Thanks. But like other parts of the village, as has been stated, the church may not always understand. And it may not be as sympathetic or as educated as you need it to be. So today, the third thing, what I'm talking about in the middle here is, though, a healthy parenting approach. That's my assignment. I don't have a silver bullet. And I don't even have a step-by-step process. But I can tell you what my wife and I have learned along the way. We're still growing as parents. My oldest is 30. He's going to be 31 this month. He serves in the ministry in Los Angeles, but for a good period of time, he served full-time as a behavioral, I believe you call it without the degree, a technician or a specialist, but he worked for a specialist, behavioral specialist. He worked with autistic and Asperger's children, and was actually very, very good at it. And I think it's because he grew up with a brother who had severe Tourette syndrome and severe OCD. And my middle child, my daughter's 28. Definitely the situation affected how our older children grew up. Now I have a 26-year-old, that'd be my son-in-law, so I term him part of the family. And then my 24-year-old is my son, Jesse. Let me actually show you a picture. That's my son, Jesse. We adopted him at 5. He turned 24 this past month. I'm glad you can see that picture, because in 2009, when we went to the Mayo Clinic, he was about 70 pounds heavier. Like a lot of our children, he was on some medications that caused him to have incredibly intense appetite, and it made him miserable. The food didn't make him miserable, but what happened as a result afterwards, of course, did. So I'm glad you can see that picture of my son. People with disabilities have been part of God's family from the very beginning. And though not always, Jesus often brought healing to the person or the family involved, but it wasn't always physical in terms of the healing that he brought about. And that's important for us to remember, because some of the things you and I are dealing with, we will be dealing with for the rest of our and their lives. Amen? That's just reality. I want to show you a passage here that I find interesting. 2 Samuel 4:4. Jonathan, son of Saul, had a son who was lame in both feet. He was 5 years old when the news about Saul and Jonathan came from Jezreel. His nurse picked him up and fled. But as she hurried to leave, he fell and became disabled. She was trying to protect him. And as a result of the attempt to protect him, he was injured and became disabled for the rest of his life. His name was Mephibosheth. I was listening to the radio. Anybody else listen to the sermons of denominational ministers periodically, you know, and sometimes you just kind of grab them and you listen. I don't listen to a lot of them, but I was listening to one earlier about a week or two ago, and all of a sudden he started talking about Mephibosheth and just the dynamics he may have experienced. And it got me thinking about this class. He was Mephibosheth was disabled in his feet, and as I said, it was a result of somebody else trying to protect him or help him. It's not always a result of just how they're born. Sometimes it just happens. Disabilities come in all shapes and sizes. You know, the consequence of impairment may be physical, cognitive, intellectual, mental, sensory, developmental, or some combination that results in the restrictions on the individual's ability to participate in what is considered normal. Now, I have a question for you. And please, somebody tell me what normal is. The older I get, and I'm 58 now, the definition of normal seems to keep changing. Things that I grew up thinking were not normal are now normal. And so, a disability, someone who isn't necessarily normal. How many of you have ever said, how many of you, your son or daughter with special needs has ever said, I just wish I was normal like fill in the blank. He doesn't have to fill in the blank. She doesn't. Anybody else like me in there? I mean, I hear that often. I hear that often. Normal. As I said, what is normal? What's regular? You know, it says average intelligence. What's average intelligence? Here's what I do know. Here's what I do know. The psalmist said, for you created my inmost being, you knit me together in my mother's womb. I praise you because I'm fearfully and wonderfully made. Your works are wonderful. I know that full well. God created your son or your daughter or your sons and daughters, even with their disability if they were born with it. Just like He created you and I. God does not make mistakes. Now, an interesting passage that let's go to for a second. For we are God's handiwork, created in Christ Jesus to do good works, which God prepared in advance for us to do. God has handcrafted our children, our kids, and us physically, mentally, emotionally, and spiritually. And He created even your special needs child for a purpose, to do good works. Central to your and my parenting needs to be the conviction that we believe that about our son or daughter. Yeah. Because your special needs child needs to believe that. And if you don't believe that, they won't believe that. You know, I had a conversation with someone, I think it was a day or two ago, I forget whether it was yesterday or the day before, but we were talking about his situation with his son, and I asked him a question. I said, are you comfortable sharing X, Y, Z? And he said, actually, I'm not. And I stopped for a second. I thought, that's awesome. Because right now, he is protecting his son's dignity. And for those of us that have children with special needs, it's very important that we protect their dignity. Because they so much want to be like so-and-so, but because of whatever, they oftentimes don't feel that way. I've got a couple of things I want to share with you here, but before I do that, I'm in the ministry, so obviously you're going to hear some of this stuff. Characteristic, I've got to go to a variety of scriptures or thoughts on this that I think are helpful. How many of you have watched, how many of you have seen the movie War Room? How many have not seen that movie yet? If you haven't seen it, please see it. And if you have seen it, see it again. This is a quote from that movie that I think helps us, can help us. And Miss Clara, you know, she said, then I started really studying what the scriptures say, and God showed me that it wasn't my job to do the heavy lifting. Now that was something only he could do. It was my job to seek him, to trust him, and to stand on his word. You've got to get out of the way and let him do it. You know, especially these parents, sometimes we just go after this stuff and we feel like it's all on us. We've got, all of us, me. We have to remember to leave the heavy lifting to him. Not on my notes. A week ago Sunday, I'm doing what I do periodically with my son Jesse. I take out his remote control that looks like about the size of the present dumb phones, and I put it up against his chest to check his battery, to see how we're doing. Because about every 3 years we have to go back to the Mayo Clinic so that he can get that replaced. Like batteries, it runs down. So instead of seeing the normal numbers of 3.0 and 3.0, I see a doctor's face and a telephone on a Sunday night, which you're probably more familiar with those type of situations than I am. And all of a sudden I realized, well, I don't really know exactly what that means. I better go get the manual. And you start feeling this pressure. You know, what do I do? Haven't been here at this point before. Well, we've got to let God do the heavy lifting. And so as I share 4 areas that at least Nancy and I have come to understand, I'm sure there are more and you can help us understand them and we'll help each other understand them, but I'll share 4 with you that I think are important. And I'm going to do my best to remind all of us as we hit these to include them specifically in prayer. Number 1. I don't know what happened, but somebody wrote. There we go. We'll go back to it. I want to start with what the Shapiro shared about, and I really appreciated them hitting this. As I said, you're going to hear some things probably repeated. Number 1 is other siblings. This area is so crucial in our special needs parenting. Let's start with what is often considered last, and that's the other siblings. My 2 older kids love God, are mature, but life changed radically when we wound up adopting Jesse, and 2 years afterwards realized that he had Tourette syndrome. The other siblings can feel that there are different standards. Reality is, there are. But sometimes that can create a resentfulness that makes it really difficult, and now you've got a new family dynamic to start dealing with. How do you manage hospital visits? Sometimes that means a lot of them. And we've got to get creative. It means at times helping our other children participate in it and still making it fun for them. And Stroebel's probably maybe the best at this because of the situation that they've been working with. But as has been said, I'm really grateful for what Mary shared. Make spending time with your other kids a priority. When you're in crisis mode, it can really feel like the other situations don't need as much. They need your time just as much. So it's got to be very, you may need to be very creative in the process of doing that. So as I said, pray. Specifically pray for your other children as they process this, how to process this. Pray for them and pray, let God do the heavy lifting for them. Because some of these things, they're not going to understand while they're in your household. It won't be for years later, right? And number 2, it's important that we special needs parenting. I'm totally cool with this. I'm fine with this. Where I serve, we actually have a 55-year-old man who has significant special needs. He comes to church on Sundays, and we do just fine. I mean, he's not 55 mentally. He's probably about 6, but we all love him. The church loves him. And one time I was just in a sermon, I'm just saying, it's great to have David back. The church is packed, and all of a sudden he gets up out of the row, comes running up, grabs me, and hugs me. I'm back. That's right in the middle of my sermon. So that's fine. We're good. It's fine. Advocate. Number 2. Your child with special needs often speaks a different language than everyone else. They can see, they can hear, they can feel differently than everyone else. Their perceptions are different from most people. When they talk, they may be very difficult to understand, and so we become their interpreters to the rest of the family, to people at church, even to the professionals that assist us at times. So, you know, sometimes moms, honestly, are much better at understanding the children than dads. That's not always true. Sometimes it's vice versa. But also, that can change in the process. I mean, it can change on a daily basis. Sometimes Nancy gets what's going on with Jesse and I don't, and later the same day it's flipped. But it's important that we really determine to be advocates for them and help them in communicating and what they're trying to express. Teamwork. So pray and let God do the heavy lifting. Pray for wisdom as you advocate for your special needs child. Let's go to the third part, which is teamwork. I was talking with Nancy about this yesterday, and as the Shapiro shared, it really begins with mom and dad, and then the rest of the family. Teamwork's got to start there. Mark 3:25, a house divided against itself will not stand. I was at Pepperdine University, took a couple of courses in their graduate program, and I chose to do a paper on parenting special needs children. At the time, I learned that 80% of families with a special needs child end in divorce. Wow. Susan informed me a few years ago, or maybe it was a year ago, that figure is now 90%. That's reality. And being Christians is a blessing, but you got to face reality and recognize that the teamwork has to begin, and we've got to work on this to maintain our teamwork to be successful in this. Mom and dad see things differently. God made it that way. Husbands, dads, don't expect your moms to think, their mom, let me start again. Dads, don't expect the mom to think the way you do, and vice versa. It doesn't work that way. God didn't make it that way. He made it so we would see differently. And as has been said, submit to one another, strive to hear from each other, and maybe completely different from what you're thinking. It also means partnership with your kids, with them. Because even the siblings see and experience things differently and can contribute to this as time goes on if you have children to help you. But teamwork goes beyond the physical family. Because when your special needs child starts acting oddly, we do need to get professional assistance. And I'm very grateful to have people that focus in this area to assist us. There was a time, as I shared at the beginning, when I didn't grasp and appreciate it the way I should have. But I'm very grateful. Hopefully, as a fellowship, we've really grown in understanding this. But you need to decide who's going to be on your team.
Yeah.
When Jesse was at the Mayo Clinic, we had Team Jesse. We used caringbridge.com to report about how he was doing. And Team Jesse was consistently updated on what was going on. Well, Team Jesse is a combination of friends, family, physicians, mental health care workers that all participate. You've got to decide and think it through and take your time to get to know the people involved. And it's not bad to say this person doesn't really work, or this person no longer fits. We need to go to someone else. That's okay. There's a fine line between advocating, as I just shared about, for your child, and respecting professionals. Amen? There's a fine line. Because that means, in being part of the team, you as the parents, you're driving, and we need to be the ones that are asking questions until we understand respectfully. That means being patient, even with the professionals that are assisting us, because sometimes we're part of them learning. They've read about it, especially if they're younger, or they've studied it, but perhaps they haven't experienced it. They may not have experienced somebody waking them up at 3 o'clock in the morning consistently for weeks on end. When we were one of the first psychiatrists that we worked with, he said, I think I got it right here. He said, treating your son is like treating a moving target. That target is still moving. I'm waiting right now on a response from the Mayo Clinic because we got to get back out there. We got to get this battery pack changed. And things have changed a little bit since the last time we've been there, so there's more that we need to get some assistance on. Don't fight with your doctors. think one of the mistakes that we can make when we're in this situation is that we can get frustrated with the professionals. And fighting with the doctors are the people and don't fight with the people standing in between you and the doctors. That's really not a good idea. Because you may never get to the person who can help you. If you must switch a healthcare worker, do it respectfully. And express your appreciation for what they've done to that point. Teams do switch players. Anybody follow the NBA? Yeah. I mean, the same is true when we're developing a team to help us with our children. But what I would encourage you to do is develop the importune widow approach. You know, the persistent widow? I like the versions that say importune widow. Why? Because of this. Importune means to ask someone pressingly and persistently for or to do something. Now, to do this, though, there's a right way and a wrong way to do it. Do, beg, beseech, entreat, implore, plead with, appeal to. Do this as we're striving to work with those that can help us. Don't harass, pester, press, badger, bother, nag, harry, hassle, or bug, because you're probably not going to get as much help as otherwise you would have. The fact is, we can all get frustrated and it can be difficult, but do it the right way. Amen? Amen. You know, I would encourage you to approach the healthcare workers that you work with like Abraham approached the 3 angels that were about ready to go visit Lot and Sodom. He respectfully continued to negotiate as opposed to getting upset and irritated. So we said pray. I said pray. You know, pray for God to help you assemble your team and let God do the heavy lifting in the process. It is often amazing. We're kind of amazed at times at how God has assembled our team. We have one of the top neurosurgeons in the world who takes care of our son. That's by God's grace. Amen. That's God doing the heavy lifting. Persevere. Persevere. I've said, that the comments I shared were consider the other siblings, advocate for your child, teamwork, build your team, but finally persevere. I was tempted when I was preparing this lesson to say you need to have a junkyard dog tenacity when it comes to this. But I stopped short because junkyard dogs bite. People don't like to be around junkyard dogs. Be persistent, pleasantly persistent, and persevere yourself. Don't quit. And as I've been sharing with you, pray that God will help you persevere, because for all of us in here, I'm sure we can share the different point in time where we thought, I just don't know what to do. And I keep saying pray because there have been so many times in our situation with our son, again, we adopted him at 5, his Tourette's began manifesting itself at 7, that my prayer has simply been, God, I don't know what to do. Please. God, I don't know what to do. Do you hear me? I don't know what to do. And so it's really important, though, that we persevere. We're still all on the journey. I'm not standing up here as an expert. My son is 24. I'm still on this journey. Pray for me. I'll pray for you. You know what I'm saying? Mephibosheth, evidently in Hebrew, stands for meaning from the mouth of shame. And sometimes when we're in these situations, whether it's the individual, the child, or even the family at times, you can feel like a little bit of ashamed of what's going on. This powerful verse I want to close with here, that I think is fantastic. Remember, God is the one who designed this, who put your son or daughter, or sons and daughters in your family. But Romans says, not only so, but we also glory in our sufferings, because we know that suffering produces perseverance. Perseverance, character, and character, hope. You see, hope is what we want. Amen? Amen. But there's 3 steps in advance of that. Suffering, perseverance, and character that lead us to hope. And hope does not put us to shame, nor will hope put our children to shame, because God's love has been poured out into our hearts through the Holy Spirit who has been given to us. You know, sometimes when I meet people that have children that have special needs and they don't have God, they don't have the Holy Spirit, I just wonder how you make it. How you make it. So yeah, the road that we travel is not the easiest road. As the Shapiro shared earlier, the notes that we took in the regular parenting classes, you can pretty much file them and start over. But it's a road that God has chosen for us to walk on. I know one thing. I mean, I get frustrated at times. I have to confess at times that I'm frustrated in the situation I'm in. And yes, I can react not the way I should react. I can be rude. But I tell you what, I love my son. And the further I have been the more I've been involved in his life, the more, even after those difficult times, the more he is awesome. When we were at the Mayo Clinic, before he went in, some of you know, I don't know how many of you know my son's story. Some of you probably know it and read the book. And anybody else familiar with this? Anybody not familiar with this book, Resurrected Mind? Okay. This is, my wife wrote the story of how our family dealt with our son's Tourette syndrome and his challenges. And yeah, I got copies, and yeah, I'll be happy to sell them after everything's done, not in the middle of it, but after everything's done and our workshop's over. But before we went in for Jesse's brain surgery, the last thing that happened after he had a really difficult time in the pre-op room, and everybody in the pre-op room found out he was having a difficult time because he got very anxious. But we were able to, he was able to get a sedative. We were able to head through and head towards the operating room. And the last thing he said to me was, "Am I still your hero? You know, your kids so much want to believe and so much want for you to see them." I got to be honest with you. My son has a higher pain threshold than I do. He has a higher pain threshold than most men do. He is a hero for me. Some of the things he does frustrate me, but hey, some of the things I do frustrate him. Amen? That's all I got. I'm open for questions. I'm going to do my best to repeat. Be brief as you can. I'll try to repeat your question, and then I'll try to answer it to the best of my ability. Yes?
I have a question about Kids Kingdom.
Yes?
Is it best to put the kids in their chronological age or developmental age? I've got a son who's developmentally 3, chronologically 7. We got him in the 7-year-olds. It's difficult for him because he just doesn't get it.
My response, and there's more than one response to this one, I'm sure. It really depends. It really depends. It depends upon the size of the church. The question was, where do I put my child if they're chronologically when it comes to Kingdom Kids? Because perhaps they're not emotionally or mentally the same age as physically, correctly?
Yes.
Yeah. So what do you do with that? I think the first thing, the most important thing, is your child. How will this affect them? If they're in a group with much younger children and it causes them to feel uncomfortable, that's not a good place for them. Now that also can change. Remember the moving target thing? That can change. I think first thing you want to do is you want to consider your son or your daughter and what's best. And some churches, the classes are very large. Some of them are very small, and you can mix in with other age. It depends. So the first thing I would do is I would strive to figure out what's best for them. And secondly, you want to think about what's best for the other kids as well. I hope that's a good enough start to your answer. So I don't have a pat answer in terms of where. Mark or Mary, would you be able to answer that one? You got anything more, Michael? No. All right, Susan. Susan said support with one-to-one age-appropriate peers in the class. And sometimes that's very helpful. So Hope that's helpful. Next question, yes?
Well, actually, I was going to kind of respond to Kingdom Kids.
Please do.
My name is Joe DeGretti. I've been involved with the children's ministry, Kingdom Kids, for about 19 years in Chicago. And over those years, unfortunately, we've seen special needs become more and more of an issue within the church. I myself do not have a special needs child. However, we've dealt with special needs on a lot of different levels over the years. In answer to your question, I think it's very appropriate that you really need one-on-one care, no matter what class it is. You really need in your ministry to make sure that the leadership knows that you have a special needs child. Whoever oversees Kingdom Kids needs to know that you have a special needs child, so that there can be special arrangements made. You can't just put your child into a class without the teachers knowing, the coordinators knowing, whatever. Because in most cases, Kingdom Kids is not prepared for special needs. We don't have special training, with the exception of maybe a handful of churches across the country. None of the Kingdom Kids programs really. However, you should know behind the scenes, it's a very big issue that's being discussed within Kingdom Kids leadership, with elders and with the church. We try to figure out what's the best. That's really one of the reasons I'm here, is to get knowledge from parents as to what to do. But you really need to be involved with it. You need to make sure that everybody knows, and I know that can be sometimes a problem if your child may have that stigma, but everybody kind of knows your child at that point. But you really need to find someone who is good in that. Check within your ministry center if you have teachers that deal with special needs, people that are involved with special needs children, can really seek advice from them and get them involved with the children's ministry so that that can help your child.
Thank you.
Yeah.
I'm proud to say that in the Athens Church in Georgia, we have a ministry. We have enough special needs kids to become an evangelistic tool. So there are plenty of parents with special needs kids in the community who can't ever get to church because they can't leave their kids. Now they can come to our church, to the Shine Ministry, and we have trained people who welcome their kids in, and then they can come to church with us. So if you're even close to that with your congregation, it's a great thing.
Amen. How many of you actually come from small congregations? Okay, I'm in a small congregation. I love what these larger churches are offering, and please do promote, encourage, take care, take advantage of that. But I know for someone like where we're at, I think helping some individuals become more aware of it. I don't really go into a lot, especially my son's 24 right now. He's not in class, he's in the auditorium, of course. But I mean, when he was younger, I want to be careful about how he perceived what I was sharing. And so oftentimes you can find individuals that are sensitive to the situation and will assist you in the process. I'm going to go on off this question so we can hit a few more things. Yes, sir. Over right there. Yes, sir.
On the issue of the special needs ministry, how much support, because we come from a small church in Oklahoma City, what is it? We see a need with our daughter and specifically another individual in the church that will benefit them, but I think the question is there, how much support do you need to get behind that to get that to really work?
Did you say how much support?
I'd like to get a special needs ministry kind of started like the Shine.
You know what? The Robys will address that when they speak, so thank you for that question. I'm going to close up now because we want to keep this thing moving forward. You know, a lot of you still have questions. I still have questions. All right? So that's why it is important that, like I said earlier, we just kind of take advantage of what God has given us with each other. And so hopefully this is helpful. Like I said, for those of you who want to find out a little bit more about what my son's story was like, and the book that was written basically talks about it from a family perspective, addressing it. It also talks about things like pharmacogenomic testing, which enables when your children have take medication. There's some pharmacogenomic testing is something that's not necessarily well known, and I think I have my personal opinions why it's not well known. But pharmacogenomic testing, if your children need medication as a result of their disability or their challenges, what pharmacogenomic testing does is with a simple cheek swab, you can find out what drugs will best help your child, which drugs are actually toxic to your child. Our son, Jesse, is an ultra-rapid processor, so they kept giving him more and more medication, but unfortunately, it was just passing right through and causing problems with his liver. So here we go. Thank you very much. Here's the rules.
Very happy to be here, and I wanted to address that question before. So this doesn't count against our time, right? I'm answering a question from a previous section of the program. Just for the record, I know we're going to go fast to get us out of here, but I just want you to know this is, it's not a part of our time. I'm being helpful. Great questions about resource classes in children's ministry, and I want to say and confess, I feel a little guilty because we've been taken care of very well in our history. Our son, our oldest son, Barrett, has Down syndrome. He's almost 25. And the San Francisco church has had a special needs children's ministry program built into the children's ministry curriculum for over 20 years. And the church is so committed to it. I'm sharing this with you to give you a vision and hope of things that are being built in other churches and can be built there. We do not have children's ministry unless you can have our spiritual resource ministry as well. If you have any room for children's ministry, you will have a spiritual resource ministry as well. Sometimes if we meet all together as a congregation, we don't have rooms for any of our kingdom kids over the age of 5 or 6. Just the youngest ones, and spiritual resource ministry. So what I'm saying, even our smallest groups, the group we meet in, it's a little over 100 disciples. We have spiritual resource ministry every Sunday. So we can talk about how to do that. You can create a spiritual resource ministry with a very, very small group, small room, without trained professionals. Don't try this at home. It can be done because you build it into the heart of serving, you build it into the heart of the church. Great lesson, we won't take time to do it, but Acts chapter 6, phenomenal, I think, incident in the early church that applies. You can use the situation, the needs we have with special needs in the church today. Back then it was the Grecian widows being overlooked in the daily distribution of food, caused an uproar because there was a need going unmet. Today it's increasing our families with children with special needs. There's a need going unmet. Yeah. The grassroots families cried out. The leadership of the church was smart and wise and spiritual, said we need to meet this need, and after they met that need, the church grew wildly. So go back and tell your evangelists, I have a key to church growth. We need to start a special needs ministry. Yeah. Please encourage people to continue passing the sign-up. So it's right there. It's all, everyone signed up. Is everyone signed up? There's a prize. Actually, there's not. I'm lying. That's the last lie I'll tell. Until my lesson's over. Then, so our lesson is called Amazing Families. Wow. I mean, talk about when you get assigned a topic. You go, we let you come talk on amazing families. Let's just say right up front, all of our families are amazing. Family itself is amazing. The concept of family, God created it. Psalm 68:3, God says the lonely family. I hope you feel your family's amazing. I feel my family's amazing. Amazing does not mean perfect. Doesn't mean always clean and neat and tidy and non-chaotic. But it's still be amazing. And it's amazing because we get a chance to have God working in our families.
Amen.
And I know there were tough questions, and that's our amazing family right there. Barrett and Nick's here with us. He's at the conference. Barrett's hanging out with my parents, his grandparents, just a couple hours ago. They're having a blast. Barrett's happy to be there. My parents are happy to have him. I just referred to that. Oh, you did? I said Psalm 68:3. Is it Psalm 68:6? Oh, well. You know, earlier, actually when Mike first got up here, he read that John 9 passage, which is one of our favorite passages in talking about the hope we have as families with special needs, because it's a family with special needs, right? That's the man who was born blind. And later on in the chapter, his parents show up. The whole family makes chapter 9. The parents weren't exactly willing participants in the story, if you recall. Hey, but they did fine. They did fine. And it's a great lesson. And I want to borrow that for the things we're going to share here. And so, just to kind of sum up what we're doing here at the end, you know, as families with children with special needs, we come in here today probably for one of two things. Either A, we want to get help with our families. We want to get help with our marriage, we want to get help with our parenting, and it's awesome to be a part of a church where we care, we can give that help, we can ask those tough questions, and we may not all have the great answers, but the truth is, at the end of the day, we're disciples in here, we have Jesus in our life, we have God working. We could have those same tough questions and be out in the world, right? Thank goodness we have some tough questions, but we still can have hope in the Holy Spirit and love and the church helping out. So we come here partly to get help with our families. Secondly, if you're like me, you want to figure out, is there something God can do with our family to help others? Even when you're in the midst of having challenges, don't you feel that way? Even when you go, you know, our family, it's tough, we have special needs, but doggone it, we still would like to help some other people. We want to see what can God do with our family, our amazing family, to help others, because I know that can be done, and it can be. And we want to share some stories, and I know there's plenty of stories like when Susan Stroebel will come up in and share her story as well. And the thing I like about John 9 is in verse 1 where it says, as they went along, they saw a man blind from birth, and his disciples asked him, Rabbi, who sinned this man or his parents that he was born blind? You know, so much like today, back then, the disciples saw a situation like this. They saw some special needs, and right away, they did what? They wanted to know whose fault it was. They wanted to know, why did it happen? Why did it happen, and where can we put the blame? Can't you relate to that as a parent, the child with special needs? I mean, doesn't that just, even now, sometimes 25 years later, there's still a party that goes, did we do something wrong? Did we not eat right? Did we not, was it because of a sin? I mean, can't you still feel that? Yeah. People haven't changed. The disciples were like that. Yeah. Thank goodness Jesus isn't like that. Yeah. Thank goodness God. The disciples were convinced it was a bad thing. Jesus said, no, this happened. Neither this man nor his parents sinned, but this happened so that the work of God might be displayed in his life. Jesus said, it wasn't a bad thing. It was something, this happened so that the work of God might be displayed. And I think what we want to talk about for a few minutes here, along the lines of God working and using our amazing families, I think there's a couple of questions we need to ask ourselves. The first question is this: are you willing to be on display? Are you willing to be on display? God wants to use your family with your challenges, my family with our challenges. He needs us to be on display so that He can do His work and show it to others. Whether that be on display within your church, on display to your other extended family members, or in your community. But are you willing? I want to have Ann come up and share.
That concept was so difficult for me. When I was actually six months pregnant when we found out our first son was going to be born with Down syndrome. And after he was born, we got a phone call from an evangelist. We actually led the mission team to Hawaii, so I think our child was like the first baby born in the church. So he's born, and one of the evangelists called us up and read this very passage to us. And I could not hear past who sinned. I could not hear past that. I could not hear verse 2 and 3 at all. Because I just thought, I think it's because I'm so sinful, God knew He had to humble me. Or God knew He had to put me through something super, super hard. And I did not at all think, yay, I get to display God's power in my life. I wanted to display God's power by I'm going to be this super crippled Christian and everyone's going to think I'm awesome. That's how I wanted to display God's power in my life. I did not want to display God's power in my life by having a child with special needs and having to deal with my heart and having a broken heart. That was not my plan, but it was God's plan. But the thing I realized so we were leading the church in Hawaii, and I did not at all know how to be open and honest about how I was feeling. And I think all of us as disciples, something happens in our life and we feel like we've got to be strong, faithful disciples. That's who we are.
And, you know, maybe some of you are naturally really good at expressing how you feel. I am not. And I am not good at being weak. And so, you know, from the time Barrett was born, I mean, I remember we used to love with our church to go have church picnics on the beach. Well, you know, you have a little baby with Down syndrome. All babies put sand in their mouth, but Barrett did for a long time. And, you know, he would run off and I wouldn't be able to find him. And everything we started doing at church became a burden. I hated going. And I'm thinking, I'm the evangelist's wife and I hate going to church and church activities. I did not tell a soul. I just endured it. Going to IEP meetings, we've all, you know, if you have a child in the school system already, but going to IEP meetings. Now, I knew my son was developmentally behind. I knew it, but just having someone, I can talk to him about it, we're kind of, Barrett's 24 now, I'm not even in that situation, but having somebody verbalize it, when I already knew, you know, he's in 5th grade, but can only, you know, barely do 1 + 1. I knew that, but having someone verbalize it, my heart would break again. But I wouldn't talk about it. I barely even cry. I don't even think I prayed about it. I'm praying about, you know, God help me to get in this next study, because that's where I was getting joy from. But I wasn't dealing with what was going on in my heart, the pain that I was feeling. And I think the effect, talk about marriage, and when you harden one part of your heart, you harden all parts of your heart, I believe. And so Brock and I became very emotionally distant. We got really good at the business of family. You take care of the kids here, I'll take care of the kids there. But we were so distant, even in our own marriage. And it took friends getting in my life, disciples getting in my life, who loved me enough to say, Ann, what's really going on? What are you really feeling? And I had to learn to be vulnerable, and finally being vulnerable where I could tell people, yes, I hate my life sometimes. I felt so guilty. I literally had thoughts, I hate my life, and I felt so guilty I hated my life. I'm a disciple. God loves me. I have friends in my life. I hate my life. I just felt so evil that I would even have those thoughts. But to actually be able to verbalize that and tell sisters that meant so much to me. And to express, yeah, I'm going to an IEP meeting, pray for me. I just get so depressed at them. Please pray for me. And things I'm fearful about, things, you know, I thought someone mentioned, I guess that Shapiro's mentioned, yes, I'm still fearful about the future. Is Barrett going to ever live on his own? I fear for what it's going to do for our other son. If something happens to us and then it's all on Nick's shoulders, and how is he going to feel about it? I feel sorry for myself. Sometimes I just feel, you know, sometimes I walk around and I'm just sad. I'm just sad. And I hate to have to tell people I feel sad. Like, I don't have the KGB running after me. I'm not living in a place where, you know, it's civil war and coups, and I feel so guilty that I just feel sad. But I have to be open about that. Sometimes I feel lonely. You know, we're supposed to be empty nesters, but we're not empty nesters, so we don't really fit in with empty nesters, but then we don't have the kids that are going to the basketball games, so I don't get to go hang up the parents at basketball or whatever it is. You know, sometimes I'm just lonely, and I don't have people in my situation. Sometimes I just feel stuck, because I feel like, you know, we can't just pack up and move and go surf somewhere, we can't go do something different. Sometimes I just feel stuck. And sometimes I feel angry, and sometimes I feel angry at my son with special needs, and then I feel like the worst mom ever that walked on the planet. And I feel like, wow, how can I be angry at my son? He has special needs. But to share that with people and get help, you know what it's done? To when I get open with other women in my life, they thank me for it. Because they think, wow, even if they don't have a special needs son, they think, yeah, I've been angry at my child too. Or yeah, I get depressed too, or you know, whatever trauma they've got going on in their life, it helps them. And then it knits our hearts together. What it's done when I've shared even with the brothers in our lives and you know, Nick's friends, and they get a heart for my son. And they get a heart for our family. And it's really built community in the church because we're open and honest about what we're feeling. I mean, I do protect my son, like Jake was saying. I don't say every little crazy thing he does, but I talk about my heart. I talk about what I feel. I talk about, you know, I get sad if he's off at church and he's pacing and no one's fellowshipping with him, and I just get sad. And I might go grab someone and say, can you walk with me to fellowship with Aaron? Or I just go up to him and then someone notices and they come. But I have to talk about when I get sad. I tell the sisters in our Bible talk, yeah, I felt really sad. Barrett was all alone at church on Sunday. I felt really sad. And then the next Sunday, they're tapping a young brother's shoulder saying, come, go talk with Barrett. It just makes people aware of your needs. And someone said it earlier, you've got to educate people. Well, educate people by sharing your heart, by sharing your weaknesses, by sharing what you feel. Lastly, sometimes I get compassion fatigue, and I feel super guilty about this because we get tired of caring, we get tired of serving, because we do it 24/7 in our own family. And so, like a couple weeks ago, we were asked, can you make dinner for this person who's sick? And I'm like, last thing I want to do is make dinner for another person. I've got to make 3 meals a day. Sometimes I feel like it's 6. And I just felt so guilty, and I have to get open about that and share that with sisters, or I'm walking around feeling guilty, and it hardens my heart. So I think, all those little things we've got to get open about and be vulnerable. And again, I think the last thing we do, I share with the non-Christians in my life as well. If I have a hard day, I tell them I've had a hard day. And it's amazing how many people in our community have a heart for our son now. And if we're out at a store and someone sees us, or sometimes people run into us and they just ask us how Barrett's doing. And I love the way God uses it to soften non-Christians' hearts, and then we can use it to reach out to them. But I really do believe vulnerability is a big, big key, sharing what's going on in your heart.
Amen.
It's just a decision you have to make. It's not comfortable. You know how it is. When you're a parent and you have a child with special needs, there's a part of you that, there's a little bit, you feel a little embarrassed, and sometimes you don't feel comfortable. You think, well, maybe other people will be embarrassed, not knowing how to relate to us. I don't know if you do that. Sometimes I empathize with other people's potential embarrassment, or some weird thing goes on. Like, I'm at peace with the situation, but I'm afraid if I unleash it on you, you'll be embarrassed, and I'll feel embarrassed because you got embarrassed. I don't know. I don't even know how to explain that. But I think part of that, I got to die to that and go, no, you know what? We're going to be out there because it's good for us to God loves our family. We love our family. We just talk to people everywhere we go. One of the first things we'll do, we start talking to people, and they ask about, you have kids? And yeah, my oldest son, Barrett, he's almost 25. He has Down syndrome. He lives at home with us. My younger son, Nick, is 23. He's in grad school. I mean, we do that everywhere. We got out of the car here at the Marriott the other day, and the bellman was taking the bags out of the trunk, and he said something to Ann about, oh, are you from here? No, we're from out of town. We're here from a conference and our son Barrett has Down syndrome. And somehow it's just like, we've met the guy for 10 seconds. We're already telling him we have, a child with special needs. We just do that everywhere we go. We just decide we're going to be on display. There's a woman back in Hawaii who became a Christian because Ann talked about being a mom with special needs. And she was impressed with Ann's heart and her ability to talk about that. And it softened her heart. She studied the Bible and became a Christian. In the community where we're at, the town we live in, Pleasanton, we walk through town, and we're very involved in the community. We've done a lot of volunteer work, and we do a lot of stuff with our family, the special needs community, and people know us for that. But the police officers know us because Barrett went through a stage where he called 911. And then not hang up and leave the line open, and so they have to come. And so there have been so many different police officers that have been visiting our house. We were walking with Barrett through downtown at a big event, and these police officers stop us, and they see Barrett, they go, and we don't even know him. They go, hey, Barrett, you're not calling 911 anymore. Everybody knows us. We're just on display. There have been a couple of times our city council has had issues come up that involve adults with special needs in different programs and issuing conditional use permits for adult day programs and things like that. And I'll tell Barrett about it. I go, you want to go with me down to city council and speak? He comes with me. We get up to the podium and we talk to city council and the mayor about it. They love it. They love it. We'll be on TV. We'll go home, man. We'll tape it. There you are at the city council meeting. Barrett and I talking on behalf of special needs. It's just a decision to try and be out there and be on display. Are you willing to be on display? And then lastly, second question, are you willing to see it as a gift? Having a child with special needs. 2 Corinthians 12. I'm going to ask our other son, Nick, to come up and share in a minute. I found someone in the Bible who can relate to what it's like to be a special needs parent. That feeling of something that you don't like and you're sad, but yet at the same time you're grateful for and brings you joy. That feeling of, if you ever received a gift you didn't want? Right. I mean, I remember, I won't take time to tell the story, but my parents got me a bike when I was 8 for Christmas. Not what I wanted, let me just say that. I was very disappointed Christmas morning. I came down and saw that. My parents must have felt bad. Later on in the day, I loved it. I became someone who loved cycling. But at that moment, it was a gift I did not want. Having a child, especially, needs to be like that. Apostle Paul can relate to that experience in 2 Corinthians 12 and verse 7. To keep me from becoming conceited because of these surpassingly great revelations, there was given me a thorn in my flesh, a messenger of Satan to torment me. 3 times I pleaded with the Lord to take it away from me, but he said to me, my grace is sufficient for you, for my power is made perfect in weakness. Therefore I will boast all the more gladly about my weaknesses, so that Christ's power may rest on me. That is why, for Christ's sake, I delight in weaknesses, in insults and hardships and persecutions and difficulties, for when I am weak, then I am strong. Paul did not want this gift. It was painful to him. He saw it as a thorn. He prayed it would go away. At the same time, he saw it as a gift. It was going to keep him from being conceited. That's a gift. If we could give you and I something to keep us from being proud and conceited, he delighted in it. It's a lot like our families. And I think that the challenge for you and I is, are we willing, through the discomfort and the pain and the obstacles and the chaos along the way, are we willing to also see this as a gift from God and to realize, because of the unique opportunity you and I have to have a family that has special needs, we've been given a gift that others do not get, and it does things and brings blessings into our life that others will not receive, and makes us into better people, better Christians, better families than we would have been otherwise. And I want to have Nick come up and share from a sibling perspective for a moment.
Awesome, yeah. So I'm grateful to be up here to talk to you guys. So I'm currently, as my dad said, I'm a grad student, and maybe some of you guys have teenagers out there. And when I was in high school going on to college, I thought I knew everything. And then when you get to college, you learn you don't really know that much, but you now know what you do know, so I'm going to go on to grad school. And now I'm in grad school, and what I'm learning is I know nothing. So, I know absolutely nothing, and all humans really know nothing, and even if I could learn everything everyone has ever known, you still know nothing. So I'm up here talking to you guys, and I know nothing. But one thing that I have known since I was a kid is that my brother was different. So my brother's 16 months older and older than me, and so I always knew that my brother was different. But he was first always my brother. He was my brother, and then he's also someone with special needs. But to me, he's always my brother. Like, I don't necessarily see him that different than anybody else because that's my entire life. But I do remember, as a kid, racing my brother to the car. And I'd be like 4 years old, and I remember getting in trouble because I would beat him to the car, and I never understood, why am I in trouble for winning? Like, I don't get it. Like, I was so confused. And I remember thinking, I don't understand, like I wanted to go to McDonald's and you guys want to go to McDonald's, but now we're going to go to Subway or something. I didn't get that. Like, I never got to choose the movie or the thing to eat. I didn't understand. And so that was something that, as I got older, I started to realize, like, what that meant for my brother to have special needs. I also remember at a young age learning a bad lesson, which was that I thought emotions were weakness. And because in our household, because of my brother's special needs, if there's a lot of excitement, then that can be overwhelming for him, and he go crazy and then break something or something. Or if there's a lot of negative emotions, then that can also cause him to go nuts, and then there's things that are broken, and I'm like, well, you can't feel anything, because if you feel anything, then it's problems. And so I learned at the age of like 5, just go in your room, be quiet, and don't feel anything. And that was something that was really tough for me as I was studying the Bible to overcome. It took a long time actually to study the Bible because I just had such a hard heart. I didn't want to feel anything ever. And I remember battling a lot with, like, like the people studying with me, like, you don't understand me. You don't understand. And I didn't want to listen to them because you can't understand what it's like to be in my shoes. So I don't want to listen to you because you can never understand. And I didn't want to feel anything because they didn't understand. When really it's everyone goes through their own thing. And I had to be willing to realize, no, this is just my fear of not wanting to feel. This is my fear of not wanting to experience those emotions. And that maybe I could never understand my brother and what he has to go through. But I want to every day to understand him. And I strive every day to do that. And a lot of that is not because he can communicate with his words, but we can communicate through our compassion and really be able to understand like that. But I also wanted to share, my parents gave me a couple other things to talk about. Okay. I guess I'll say that God uses our weaknesses for His glory, so that we don't hide our weaknesses, but rather we share them. I often saw weaknesses as less valuable than strengths, but in the case of my family, I think it's probably true that our weakness is our most valuable thing, and that's my brother. So I'm really grateful for his sacrifice.
Talking about vulnerability a little bit, and to be vulnerable, I'm feeling kind of insecure about what I'm going to talk about right now, because we've heard such great, wonderful stuff. And when I was reading Ann and Brock's bio, it said that they were the couple of the year in their community. And I was like, wow, that's not my family. And no one would be giving us awards, I don't think, for being couple of the year. But I guess what I'm going to really be sharing, I had a whole presentation with points and ideas for you in terms of how to make things maybe a little easier or work better. But as part of my preparation for this class, I went to listen to TED Talks, because we were supposed to do TED Talks. And I listened to one on vulnerability. And throughout all my notes and all my points, and what I instead want to share with you is just our story. I became a Christian very young in college, and felt like I had the world by the tail, and me and God, we were gonna, change the world, and did the campus thing and the singles thing and the teen thing, and got married, moved to California to help start the church there, and worked with the teens there, had our first baby, life's flipping along. We had a blip, my son got very ill, and but he fully recovered, and we moved on, and life was flipping along. And then we had son number 2, and shortly after he was born, found out we were pregnant with number 3, and everything was kind of turning out like we expected, our lives to be. God had pretty much protected us from most things, and our lives were good, we were fruitful, we were contributing to our ministry, we felt good about our lives and how it was going. But when I was pregnant with number 3, number 2 started to give us some concerns. I started seeing some developmental things that really weren't going too well. And I kept talking to the pediatrician about it, and then at about 9 months, he was diagnosed with cerebral palsy. And the doctor said he'll probably have an abnormal gait, and other than that, he's going to be fine. I'm like, okay. And I grieved that abnormal gait. I imagined him on the football field or on the being made fun of, or would he have a date to prom? And that created a huge amount of grief, just that little bit of a disability in my mind. But I grieved it a lot. And then as time went on, he wasn't making any developmental milestones at all. But I'm in denial. I'm hanging on to that abnormal gait, and other than that, things are going to be fine. And at about 18 months, they're like, I think there's something more going on here. We need to do some additional tests. So we were kind of going through that process. My daughter was born, and then when it was her first birthday, and Brock was now 2, and he started having seizures with a vengeance. And the first time we went to the hospital, it was for 10 days. They'd drop him into a coma, they'd bring him out, he'd still be seizing, they'd drop him back in, they'd bring him out, he'd still be seizing. And this went on and on and on and on. And I kept thinking, well, there's medication for seizures, you can fix that. So we kept waiting. I think I fired our neurologist. I think he and I decided 5 times over the course of his care, because I kept thinking he must not know what he's doing, because I know you can control seizures. Well, in my son's case, we couldn't. And in the additional tests that they did, they discovered that he had a metabolic disorder. And they said, you know, we think the seizures are kind of the beginning of the end. You're probably going to lose him probably around 3 years of age. And that was horrible news. But we're like, okay, we're going to buckle down for a crisis. We're going to give him the best life we know how to give him. And when it's over, but we can do this. So, you know, we did that. We buckled down. Seizures were sometimes every 2 minutes, sometimes every 15 seconds. He had over 100 every day. And we actually were praying, because his quality of life was so awful, we were praying that he would die. And we had our friends praying that he would die, that this would happen quickly, because he had no quality of life. And then what happened, we passed 3 and passed 4, and we saw the doctor again, and he said, he looked at Brock. By 4, Brock had finally learned to walk, and he looked at his walk and he said, you know what, I want to run another test. And then he came back to us, he said, I think I have an explanation for the seizures. He still has a metabolic disorder, but I don't think it's the one we thought he had. And what I think he has is something different, and he may outlive you. And so our buckling down for a crisis now was my life. And I should have been thrilled to get that news, but the reality was, I was like, I don't know if I can do this. This is my life. We had 2 other kids, all of them were small, close together in age, and I had moments where literally I thought, I can't do this, I just can't do this. But here's, I guess, what the relationship I really want to talk to you about today is our relationship with the church, because we did all the wrong things, and I want to hopefully help you guys a little bit. And I'm so grateful that you're here as a Kids Kingdom leader to hear, because we need advocates. It's very hard to do this sometimes on our own. We need advocates. So before I go any further, I just want to say this story has a happy ending. It's going to get dark for a few minutes, but hang in there with me. I promise you a happy ending. The scriptures that I wanted to look at, Brock already mentioned 2 Corinthians 2:9 is how Paul said that God's power was made perfect in weakness. So I'm going to share our weakness. And then also Philippians 4. In Philippians 4, if we can go there. In verse 10, can somebody give me a 10-minute and a 5-minute, would you? Yeah, 10 and 5? Okay. Okay, so I just need to hurry. Okay. I know what it is to be in need, and I know what it is to have plenty. I have learned the secret of being content in any and every situation, whether well-fed or hungry, whether living in plenty or in want. I can do everything through him who gives me strength. And in our situation, with my son being so sick, I had to quit my job, cut our income in half, so I knew what it was to be in financial distress. I knew what it was to have marital stress. I knew what it was to have family stress. If you looked at my life, in my eyes, my life was a complete failure. I lost control of my body. My house was a wreck. My kids were running around with runny noses. My son, part of his disorder was a lot of GI problems. He threw up about 30 times a day, and if he wasn't throwing up, he usually had diarrhea. My carpet was awful. I did about 10 loads of laundry a day. Our life was really a disaster. And what I found happening in our relationship with the church was I would go to church and people would say, how are you? And I'd say, I'm hanging in there. And they'd say, well, I don't know how to do it. You're my hero. And I'd say, okay, I'll give you a good example through this. And, that was kind of what my fellowship time was like. And it continued like that. And we were like, okay, Brock doesn't really fit in the kids ministry, we'll just keep him with us. And then, well, it doesn't really work out in church because he's really noisy, so I'll sit in the back. And, well, I never get to hear the sermon in the back, I'll just stay home. And so what I saw happening in our life was, rather than saying what we felt or what we needed, we kept retreating. We got a lot of pleasure and a lot of esteem from what we were able to contribute at church. And we were at a point now where we really weren't contributing anything. We tithed, that was our contribution. But other than that, we really didn't have much to give, or in our viewpoint. We weren't following the matrix that we had set for our lives and our standards for what was good and what was right and what was godly. And so as I said, our fellowship became very superficial. And just to share a few examples of some things that we said and what they really meant. Let's see. I'm going to skip through a lot here. Instead of saying, we had a rough week, what if I had said, Brock was having seizures back to back for the last 72 hours. I couldn't stay awake anymore. So I said to God, if he's alive in the morning, he's alive. If he's dead, he's dead. I have to sleep. And went and cried myself to sleep. Instead of saying, Dan and I had a bump, what if I had shared, Brock had a big seizure right after we got home from the hospital. He's on the floor seizing, and Dan and I are standing over him screaming at each other. Dan saying, you take him, you know what to tell the doctors. And me screaming back, I haven't had a shower for 4 days. If I go back to the hospital, I won't have one for 4 more. I have to take a shower. Instead of saying, Dan is struggling spiritually, what if I had said, this morning when Dan was praying, he was beating the floor so hard with his fists, he injured his wrists. And instead of saying, we're struggling in our marriage, what if I had been able to say, he's having anxiety attacks, and they're not the quiet kind. They're loud, and I'm sharing this with his permission. He wishes he could be here to share himself, but they were loud, and they were explosive, and they were scary. And I had money and keys tucked away in case I needed to get out in a hurry. And that's what our life had become. And I looked in the mirror and I'm like, how did this happen? When we started, we had a good marriage. We had a strong faith. We had a good, church relationships. What in the world happened? And what happened was we did not have the courage to be vulnerable. Because if we were vulnerable, we weren't positive that our vulnerability would be met with compassion, and we were afraid we would lose our sense of belonging. And, so if I can encourage any of you, well, first of all, let me finish the story. So eventually we ended up in professional help. And we got tools to communicate, first of all, with each other, to communicate with our other children. We got tools to empower ourselves. And we started saying what we needed and saying what we felt. And we talked to our Bible study group, and we had been our life had been a series of, divide and conquer. And we're like, we're a family unit. And this is what our family unit looks like. And it includes Brock. And we really need to include Brock in our lives. So we want to be part of a Bible talk that can include Brock too. And we kind of offended some people and hurt some feelings, but you know what? It was the best decision that we could make. And we're like, we want to contribute. We're kind of limited in terms of where we can go and what we can do, but our house is always open. Can we have a Bible talk that we can host? And as it turned out, the Young Marrieds group was a terrific group for us because they needed help with figuring out career goals and budgets and, a lot of the stuff that we had managed to figure out by then, But they were young and flexible. A lot of them had been my older son's peers, and so they already knew Brock, were comfortable with him. And we have Bible talk at my house, and Brock is right in the middle of it. Sometimes he sits quietly, sometimes he causes lots of trouble, sometimes he's communicating with his iPad, he wants to be all done, but he's part of the group. So by being able to advocate for ourselves and speak up and start to communicate a little bit better, I feel like our needs are really being met and we're able to contribute again.
But I also think about if we had been able to be vulnerable and had the courage to do that much earlier, how would that have changed the landscape of our life, of our marriage, of our family, and how would that have changed the landscape of our church? And I feel like if we had been bolder and if we had done that, then these young families who have kids with special needs, their stories might be a lot different. And they might not be going through some of the things that they go through in terms of trying to fit in. And I just wanted to share one story real quick. My friend Mackenzie's back there. Mackenzie! Scripture I guess I wanted to end with. And it talks about, well, I'm just going to reference it. It talks about the body and how all the parts work together, and every part is placed just where it belongs. And I feel like in our situation, we created an environment where Brock was sort of an appendage that just kind of hung out there, was in the way, and didn't quite fit in. And we didn't really give him his proper place in the kingdom. And so if I were to encourage you guys to do anything, first of all, have the courage to be vulnerable. It will create compassion. It'll create, people will understand your needs and be so much more ready to be compassionate and try to solve problems with you. Let your child take his proper place. Our kids are great teachers, don't we know that? Who has taught you more than your child with special needs? And those lessons are not meant just for us. They are meant for our church. And God put our children in our family and our families in our church to be teachers. Don't shelter the church from those lessons. Be willing to lean into what's uncomfortable in the conversations and the things that you say. Don't worry if this is going to be hard for somebody to hear. You're going to make somebody feel uncomfortable. You don't want to be Debbie Downer, all that stuff. Please don't think like that. God has put you in this situation with your child and your child in this situation to make the church a better place. Amen. If we don't let them take their proper place, then our church isn't whole.
That's right.
It's missing parts.
That's right.
And our family is going to help fulfill the needs of the church. And I'm so glad Jennifer and Michael are here. And they've lost a child to a disability, but Jennifer does such a great job being vulnerable. She'll put on Facebook days when she's feeling sad or pictures from the cemetery. And I'm so grateful for her because I remember to pray for Jennifer because she's vulnerable. And we all have stories, and we could, leave this podium open all day, and you guys would all have amazing stories to tell, I know. But we just need to make sure our churches know and that we're being vulnerable and that we're letting our children have their place in the kingdom. Amen.